So a brain tumor is an abnormal growth that occurs in the brain or something that's pushing on the brain. It's a rather large term that many types of tumors fall under. We separate them either by location or the type of tumor it is, with the most simple way of differentiating it from a cancerous brain tumor and a non-cancerous brain tumor.
So usually when patients present to us with a brain tumor, it may be someone who's coming in with a symptom of a headache that has not gone away for several days. They may be evaluated by the primary care physician. They may present to an emergency room because they're having very severe onset headaches. They may have stroke-like symptoms. So when these patients present to the emergency room and get diagnosed with the brain tumor based on a scan, usually the patients are then linked in to our Brain Tumor Program.
The Brain Tumor Program at Franciscan Health offers a multidisciplinary team of surgeons, medical oncologists, and radiation oncologists, as well as expert pathologists and radiologists. We also have a wonderful interdisciplinary team of nurses, dietitians, speech therapists, and physical therapists.
And then tying them all together is a nurse navigator who helps make the journey for the patient very smooth.
Patients need that exclusiveness of knowing that they're going to be okay, and they need emotional support. They need support from just the standpoint of getting their appointments, make sure they understand their appointments and when they are, and so they have questions when they get home, and it's hard for them to just call the doctor's offices. So if they can have a point of contact that they can call and say, you know, I think I missed this in the appointment, or I'm not sure if I'm supposed to go here or there, or what I'm supposed to do, you know, we can kind of help them through that. Hence the name, the navigation, will help them navigate the entire programs.
We established the Brain Tumor Program at Franciscan Health to provide the highest level of patient care for complicated brain tumors close to home. At Franciscan Health, we have extensive experience of combining this multimodality complex therapy with our wonderful and experienced medical oncology team.
I think this is such an exciting time to be a medical oncologist. What we now have is a myriad of options that have opened up by doing these mutation analysis or tumor specimen testing. What these testings allow us to do, or what we call next generation sequencing, is identify mutations that may be unique for every patient's tumor type. Now we can say this particular mutation in this patient is going to respond to this particular treatment. So that is a very exciting era within our brain cancer treatment program.
Surgery is an important part of brain tumor treatment. Usually we're talking about removing the tumor if it can be done. That we always aim to remove all of it safely if possible. Sometimes that can't be done given the location of the tumor. A lot of times, if we don't have a diagnosis already, surgery is the first line so we can figure out what we're dealing with, and then based on the diagnosis, the appropriate treatments can be delivered.
Sometimes brain tumors are located next to highly critical and delicate structures such as blood vessels and nerves. Radiation therapy for benign tumors can provide highly precise treatment that can shrink tumors 90 to 95% of the time without requiring surgery.
Many brain tumors are benign, and those are treated differently than malignant brain tumors. And when someone has a benign tumor like that, observation is usually what we recommend, and they will get follow-up MRIs, and should they develop symptoms or if the tumor were to have substantial growth, then treatment would be undertaken at that time.
And then on the other end of the spectrum, we have very aggressive brain tumors such as glioblastomas. These tumors, depending again on the size, the location, the chance that this is completely removable, may be treatable to potentially curable, but have a higher risk of relapse or have a higher risk of disease recurrences. That's why it's so important that the patient gets appropriate care in the right setting, because the quality of your surgeon, the quality of your radiation oncologist, the quality of your medical oncologist makes all the difference.
So if someone feels that they may have some signs and symptoms of a brain tumor, the first thing is talk to your primary care provider. They're going to be qualified to assess you, and if they feel that you may have these symptoms consistent with that, they're going to order imaging. And today, an MRI is really our best test to look for that. There are other tests that can be ordered if someone can't get an MRI, but an MRI is going to be able to confirm that you do or don't have a brain tumor. And if you do, then obviously we're very happy to help treat you.